Next up, I'd like to invite up Donna Bandoloni, Senior Consulting Associate with the Heaton Smith Group. Donna, there you are, coming up. The light was blocking you. It's not because of your height, as we had that conversation earlier.
I wanted that.
I know.
To be sure.
She wanted to be sure. Donna is going to moderate our next session, which I know you're going to find equally fascinating. It's entitled Speaking the Same Language, How Hospital Finance and Foundation Build a Stronger Relationship. This session will discuss how hospital finance and foundation can speak the same language, agree to fundraising goals, that'd be a miracle, driven by donor pipelines and meaningful metrics, and ensure the foundation is focusing on the top strategic initiatives of the hospital. So Donna, I know you'll be introducing your panelists.
Yes.
Thrilled to have you here. Thanks for your leadership.
Shannon. Thank you. I want to thank AHP for inviting Heaton Smith to be a collaborator with you for this conference and summit. It's been a pleasure, and I thank you for the opportunity, and also to introduce Dave Smith, who unfortunately last evening when Alice was introducing folks, Dave was busy working, as he does regularly, and unable to be with us. So just for a moment, Dave, would you please stand with Heaton Smith? And for those of you who may not know what Heaton Smith does, we actually speak to donors about many important things. Many of you in this room strive to secure many types of gifts, and to be diverse, we have planned gifts as part of the offering major, annual, and principal. And so we have legacy discussions with donors and try to make those donor-centric as well as values-based. So thank you for that. Today I have the pleasure of introducing two panelists with a great deal of experience and knowledge, and I think just perfectly suited for our discussion today. Let me first introduce David Collis. He is president of AdventHealth Foundation and has spent more than 20 years working with nonprofit organizations to help advance their missions through effective fundraising. He oversees 7 foundation boards and is a member of the Health System Philanthropy Leadership Group, comprised of 15 foundation presidents from large healthcare systems from across the nation who are dedicated to advancing best practices in the industry. That's why we're all here, right? To learn more best practices. Todd Goodman is Chief Financial Officer of AdventHealth Central Florida Division, which includes 16 hospital facilities, including the flagship AdventHealth Orlando, and dozens of outpatient facilities and central care, urgent care locations. Under Todd's leadership, AdventHealth Central Florida is implementing strategies that strengthen and advance the organization, including lowering the cost of care and improving the affordability of health care in our communities, rapidly expanding the outpatient network and developing a high-performing, clinically integrated network. Please help me welcome both Todd and David. Thanks, David.
Thank you, Todd.
Todd, thank you. I love sitting here. I feel equally as tall as these gentlemen. Would you agree? Anyway, I thought I'd start by sharing a personal story about speaking the same language when in a development role. So for the last 15 years, I had been director of gift planning for 2 major medical systems in the Bay Area, in San Francisco. Most recently at California Pacific Medical Center, and prior to that, I was the director of gift planning for Lucille Packard Foundation for Children's Health at Stanford. And when I started at Lucille Packard, I had recently, before that, my leadership was on the philanthropic side for financial service institutions. Talk about acronyms, vocabulary, and trying to make the shift from the for-profit to the not-for-profit. It was a learning curve for sure, but I knew how important it would be in order to be successful in my role at Lucille Packard. And I was passionate about having conversations about planned gifts. The new CFO came on board, not long after I was there. And Kathy came from the tech world as a CEO for startups. Talk about clash of culture and conversations. So when I first had my meeting with Kathy, I came in prepared to think about, what does she want from me? What can I do to help her make her job a little bit easier? And how do I learn her vocabulary so that I can be sure I'm communicating in the best possible way? Kathy let me know for sure, Donna, this is an area I know very little about. But with your help and with our ability to meet on a regular basis, I'm hoping you're going to help teach me. So together we formed a partnership, and it took us a while. There were some speed bumps. But along the way, we grew to understand what was most critical and important to be successful in creating this fundraising environment at Lucille Packard. Well, I've had the pleasure of conversing with Todd and David, and I've been learning a great deal about how they have worked over the last several years together to make a more collaborative and more cohesive unit for Advent. And I thought we might start by my asking Todd to talk a little bit more about how he articulated to David, get on board, David, so that we can speak the same language, by helping define what was critical for him and for the institution, and by setting priorities that both David could learn how to speak the language as well as to quickly get on board. So Todd.
Thank you, Donna. It's a pleasure to be here with you today. It's a bit intimidating to have so many people that want money in the same room together. But I have to say I'm grateful for what you do every day, and I know your C-suite and financial leadership team is as well, because it can be an amazing partnership. I'd like to take all the credit that David and I developed this close working relationship that the foundation and finance has in our organization, but frankly, it predates both of us. It was 20 years ago that I was the new CFO at the foundation in our organization, and our organization has always, from day one that I can remember, and it predates my time, has established a CFO at the foundation, which in our organization historically has been a manager or director level finance leader, and that's what I was 20 years ago when I was the CFO at the foundation and got to interact with the president and the boards and the plan giving, got to understand the difference of a planned gift, of a pledge, and of a cash gift, and figure that out. So we have a long history of working together intentionally, working together to set goals and metrics that make sense as an organization. And we haven't always seen eye to eye or spoken the same language, but over time we've really worked hard to make that a reality.
Was there any one specific area, Todd, that you could elaborate a little bit more about this, about where there may have been difficulty in seeing in the same direction, perhaps?
So I know originally the concept of really what kind of return should we get out of a foundation was an important dialogue that we had to have between the leadership of the foundation and what their value proposition was to the organization and the community, and what we felt comfortable as an organization committing resources to that end. And, you know, like anything in life, some years are better than others, and some perspectives are better than others, but we spent a lot of intentional time coming up with a model that we believe works for us and our organization and the resources we commit in this space.
I think that's a perfect segue to leading into David's conversations about ways in which investment, improving through metrics, how important the return is by investing in philanthropy. And under your leadership, David, perhaps you can share some of the ways, some of the tools, and some of the metrics that were set that you could safely say you were on track.
Right. So I think we talked earlier about gratitude really being the center of what the foundation and philanthropy are about. And I think that Randy Varju talked about without trust, there's no gratitude. I would say without accountability, there's no trust. There's no trust, there's no gratitude. So I think what we had to do at the foundation was work with the finance team, because a lot of times our work can be a mystery. How does this happen? How do you go out and sit with someone and then money comes in or doesn't come in? You know, they didn't realize that there's a process to this. So we have been a very metric-driven foundation. We measure visits, we measure solicits, we track everything, and we share that openly. And I think that was one of the starting places that we were. But our COO for the system, Lars Holman, is here. And I remember him saying one thing when I first started, which was, David, the dollars that you raise are very important to the hospital, but the most meaningful and most important thing to me are the relationships. And that really set a tone that permeates all of AdventHealth. And in fact, we hit our goals many times, but many times we don't. And that relationship still maintains strength because there's that trust that we're doing what we should be doing in the community and developing those relationships. And so I think that's helped us speak the same language to a certain extent. I mean, there's things that early on we didn't quite communicate well on. I think we used to show the gap report to our boards, and you'd have $1 million donor in there that just made their donation and they're looking for their gift, and you all know that it's net present value. Maybe it's $800,000 or $750,000, and the donor's poking me saying, hey, why is my gift only worth $750,000? And so we did work out a situation where we have gap, but we have a fundraising look. But that was negotiated so that the community could see what the donors wanted to see. Because the comment quietly was, well, if you only want $750,000, then I'll write my check for $750,000, because it wasn't showing up on the report the right way. So we did work through things like that.
Often I hear, and I'm sure you all in the audience have experienced, kind of the wish list for what the CFO would consider to be a little bit more donor-centric, talking about gift acceptances, gift pledges, various gift agreements. And one of the things I was curious about in speaking with them is, what is the process for you to early on try to match the donor or the donor's interests with the institution's priorities? Some of the ways in which you've done that for various core elements or core focus for the institution. Can you elaborate a little further about that? Because I know that CFOs in my mind they want the development people to be early on in front of me having the conversations about the donor's intentions, their passions. It's not always going to fit in a box that meets the needs of the CFO. So I'm curious, how do we develop a better communication strategy to meet donor intention with the actual execution and make our CFOs happy to see the bottom line? How do we do that?
We want our CFO to be happy.
So I will, if I'm totally honest and transparent with this group, I'd have to confess there are times I've been that CFO that says, you can't be truthful. You're kidding me. We're spending money on what? Oh, well, we have a donor for that. Well, why didn't we get a donor for something we really, really need to have?
Exactly.
I've been
the
that
chiller plant.
I've been that CFO. But I think we're doing much better today. That I would not say that we've arrived at that, but we are clearly doing a lot better. And the key to doing better, to be honest, is bringing the foundation into the planning process earlier. And I see a lot of folks nodding their heads, but I can't underestimate that enough. If David and his key team members understand what our strategic priorities are, what our funding gaps are, what we are really trying to accomplish, it is much easier to align the gifts that we are pursuing with the goals of the organization that we're trying to actually execute on in this business plan cycle. And when we've done that, and I think we've done that, right, David, quite a bit better over the last 5 to 7 years, we really have seen much more focused results and results that really help us execute our business plan.
I agree, and that required support to be invited into the room when the big vision was being discussed. And so now the foundation actually reports up through strategy. So we get to see things as they're being baked, and we don't actually go out and raise money for it until they're signed off on. But just being at that table and being able to see what the big priorities are has empowered our team to feel more motivated to want to go after gifts for those main priorities. And I would say that we all know that foundation, we're always asking for that big vision. Big dollars follow big vision. And so being at the strategy table early gives us that runway. It's, it breaks my heart when 6 months before something's going to launch, they come to the foundation, and and it's not their fault that something happened where they're going to do this, and I didn't have the runway to go out and really engage the community the way I wanted to. So when we get the runway, we're out there, and I'll compliment Todd and the team, is that, very generous, mission-centered organization. Todd is a donor. He not only comes to all of our board meetings, he's good with donors. He's there introducing us, just introduced me to somebody that's probably going to end up being a board member that's a personal friend of his. So it goes beyond just being at the table for the big vision. It is that finance is actually helping us identify people in the community for that big vision. It's not the foundation's job just to go out and do that. They're there, and the other C-suite members are there to help connect us. And so that's exciting, and that gets us excited to work together.
I think we've been hearing all day today, and it's been so refreshing and exciting to listen about the various ways that people partner and collaborate, and in addition, strengthening relationships that are around meaningful gifts for their hospitals and their communities. I'd like to hear a little bit more, and perhaps the audience would as well, about a strategic priority that you have where you are working internally with staff, right from the CFO as well as, CEOs and presidents, together united so that people understand the priorities and are working to not just internally change with the direction of the giving, but how the community will respond as well. And I know there's a project that you've been working on that's exciting, and I thought we should share it here today. So.
Well, I mean, we have a few. We tend to focus on what we call the 3 C's: cancer, children's, and cardio. With our children's hospital, the needs, we all know that children's hospitals don't make money. They don't even break even in most cases. And so we're constantly looking for big vision there. One of our big donors is a local corporation that you might know of, Walt Disney. And they named a pavilion at our children's hospital. And with their gift and announcing that gift to the community, we were doing a $100 million expansion to the children's hospital. And the foundation's goal was to raise $25 million of that. And with Disney's gift, it really helped us promote that in the community, bring great attention to it, but also communicate it in a way that the need was apparent to donors. And I think we all rallied around that as a hospital team, as a foundation team, and engaged the community in having a huge success and exceeding that $25 million goal that we had for that facility.
I think engaging in big projects like that early and in the planning process, it really allows the foundation to work with the facility to activate all components of our organization, whether that be our staff in communication working with that, because we have a very engaged staff that participate highly in our 1908 Society and work through that, and really are very philanthropic at heart, given the mission perspective of our organization, but also our physician base and our various vendors and contractors we work with. It really does allow, when you have a project that's organized together like that, it allows for a holistic perspective that David kind of references there.
Yeah, it actually brings the hospital community together, and it's really a team building opportunity. We have a little less than 40% of the employees at AdventHealth give back out of their paycheck every 2 weeks because they believe so much in the mission. That translates to engagement not only of the C-suite, but also with your nurses and your physicians. And having a culture like that, it's a blessing to work in an organization like that. So when we're raising money for children's, our CEO is a NICU doc, and he and his team and nurses all have helped connect us in the community, donate themselves, and they feel like an extension of the foundation team, if you will, an extension of our mission, quite frankly.
It seems that it sounds very rosy here. There haven't been enough bumps along the way that I think we need to explore a little further in terms of, we know where they are right now, but what are the areas they're striving for that need improvement, right? It's not a perfect world in every institution. We're constantly striving, assessing, going after more. One of the areas that I want to touch on also is the fact that we were hearing about donors being engaged and gratitude being a real focal area with grateful patients. What I was curious about, and I want to talk a little bit about this with Todd and David, is the area of stewardship. Because I heard about physicians saying, yes, I want to allow the donor to say thank you. But also to go a step further, how do we engage staff on all levels, including the finance office, since Todd already has admitted how engaged he is? What do we do to keep those donors engaged so that they can continue to support us for those programs and services they care passionately about, as well as to provide great opportunities for deferred giving or gifts to sustain these programs? So I want to hear about that and see if we can think about the perspective of finance as well as foundation.
So I'll start from my perspective, touch on a couple of questions you just asked, because it's a broad spectrum there. So one of the things I do think we're doing better is we will have a donor that has an interest in one area, and David and the team will do a good job plugging in with them, connecting with them, and providing them an opportunity to give and to work through that. But that's not really where that relationship ends. We have a number of donors that have extended their philanthropy into a second and third gift within the organization because of how plugged in they've been into our foundation process and into the governance process within the foundation and in parts of the hospital as well. And it's that engagement that makes a big difference. One of the things I think we're working on to do better is how do we plug in our clinicians and our physicians into that process, because many of our gifts are started from a genesis point where somebody does have that grateful moment. And they really want to connect and say thank you. And then once they connect and understand the mission of the organization, the needs that we have, and the strategic goals we're trying to accomplish, they often find something that they want to plug in better in that and walk through that. And I'll let David give you a couple of examples. But that is an area I know that we are in the process of saying, how do we take the next step forward and how do we get better at that as an organization?
Mm-hmm. And what kinds of information would those donors require? Are they financial? Perhaps. Are they more informational about impact and what it can do for the community and for the system? So I think that would be really important to think about as David is building ways to educate internally the staff as well.
Well, Todd just helped us with a donor who's been very generous over many decades that wanted to invest in AdventHealth University and really in our online programs. And working with the foundation, we'd gotten to a certain point, and we brought Todd in because we needed some financial modeling. We needed some targeted accountabilities for when the gift would be paid, when we met certain thresholds. And it really helped, this person being an entrepreneur and a finance person, the donor themselves, having the CFO come in and kind of help spell that out and make sure that everybody was in agreement about what the hurdles were to receive the gift and what success meant at the end was really critical. So to have Todd there really helped us advance that. Without Todd, I'm 100% sure we would not be receiving that gift.
You know, it's rare that you have organizations where the CFO is involved in donor meetings. Would you agree? It's rare in my experience. In fact, I can only think of it maybe once or twice. But I know how important it is, just I guess, assessing your audience, knowing who you're presenting to as that donor couple or family or individual. It's really important to have a team effort for some individuals because they do need to hear that financial perspective as well as what their investment can do for the organization and for your work going forward.
It makes a big, you also asked about things we're working on. So typically our foundation will send over $15 to $20 million in cash over to the hospital a year. This past year, I think it was more in the $27 to $30 million range. And one of the things that, and some of you might deal with this as well, is that donors give the money so that we spend it effectively and efficiently and timely. And we're trying to get on, with the help of finance, onto quarterly distributions out to these
More regularly.
programs. We tended to be year-end focused, where probably 70% of the money was coming more towards year-end. And we realized that we need a different system. And that's something that I think will allow us to go back and steward our donors in a more timely fashion, as well as make me feel better that we're being good stewards of that money and that it's going out and being used a little bit sooner than we had been distributing it. So I think that's one thing that we're working on as a team.
And I think one of the next cycles of improvement is donors want to understand more than just a thank you for their generosity. They really want to understand their gifts making a difference for that intended purpose. So I think back to the donor Dave just referenced, and his focus was, I want my donation to serve the purpose I intend it to serve. And so that is one of the things I do think as an organization, it's one of our next cycles of improvement, is how do we actually complete a more comprehensive report back to the donors that has some financial information. It'll have the heartwarming stories and the touch and the difference it makes in the community, but they really do want to understand that their gift is meaningful, that it makes a difference, and that ultimately there's some sustainability behind that gift to make sure that it has a lasting impact longer than just the gift itself.
Yeah, I agree.
I think there are a few questions. I'm seeing some hands and some heads. Certainly, gentlemen, right there. There you go.
Thank you. Thanks for the great presentation.
Thank you, Mark.
Thank you, Mark.
Go Gators. Can you talk a little bit more about, obviously you two have a strong relationship. You've worked a lot together. Specifically, David, are you at C-suite meetings on other topics for operations, in the room, around? Are you in the C-suite with your office? What are the ways that you are connecting more to help build that relationship? Because I imagine it just isn't, let's sit down and argue about the metrics and now we got a great relationship.
Right.
There's got to be more to it than that.
Right. So the foundation is located in the executive tower. Through my roll up through strategy, I do attend the meetings that are important for me that relate to long-term and short-term strategy. I get called into C-suite meetings when they pertain to foundation or foundation opportunities. I do not sit at that table with our reporting structure and the number of hospitals we have. I agreed that I would not report directly to the president of the hospital, with the agreement that when I needed that person for visits and to get on the calendar, they would be willing to be flexible with me, and they've lived up to that. So I feel like I'm getting the information. I did explain to the president of the hospital that it was non-traditional for the philanthropy leader not to be at the table. However, it has not affected our working relationship there, so I'm connecting through other ways. And I did say I would speak up if it wasn't working, but up to this point, 2-3 years in, it's working just fine. So I do that, and then I attend finance meetings. We have foundation close meetings. We also get to meet when we do our foundation board meetings. So all the executives attend our foundation executive board meeting, which are the heads of the 7 foundations plus members at large. So there's very good communication and ongoing. And then the doctor and nurse piece is really important, because what the foundation focuses on builds us into their teams as they're building these new vision. And so we're a part of those conversations. So we probably get maybe more granular than we would if we were sitting at the bigger C-suite, but it helps us do our job and go out and communicate that to donors that might be interested. I don't know if that answered your question.
I would just add, David's office is 2 floors below mine in the CEO's office, and when David needs on my calendar, the CEO calendar, we generally find time for that and make that happen. What I think's made a bigger difference, and I know David probably didn't want to hear this at first, and many in the room might not, but reporting or being involved in the planning process from day one is much more important than who you report to in the organization. And I think we've kind of proven that. At the end of the day, I know David had questions when we brought this new structure in and he was going to report to the strategy officer and not to the CEO, because that's kind of non-traditional. But the fact that David's involved from day one in that planning process has been a bigger win for us
I
than the
shouldn't say
change
this
in the
out loud, it's
organization.
probably better. It's probably a better system the way we've got it.
You probably get access to more of her time
Yeah.
than his
Yeah.
anyway.
There's another question. Sir.
Todd, David comes to you and says, I'm having some runway issues. I can't just get a project in 6 months. What if he proposed to you, hey, next year when you're setting the budget and you're talking to all your department heads, 60% of the projects must be either 24 or 36 months out. Would that fly in your organization? Or are you so focused on the next fiscal year that that would be a challenge?
So make sure I understand the question.
So he comes to you and says, hey, I want to start building in some runway. We want people to not just think 12 months out,
Yeah.
but 24, 36 months out. So next year, 60% of your projects, if you want the foundation involved, 60% of your projects have to be 24 to 36 months out to build in runway.
So like any organization, we have some projects that have shorter timelines, and we probably would not let the foundation process slow those projects down. Where I think we have done a good job and where we're at is we have a lot of runway on a lot of projects. We have many projects that are 24 to 36 months out. And what I try to endeavor, and I think what David's been successful at, is how does he get at the table early on those projects? We have had projects where the foundation is committed to XYZ dollars and the project's going on, and for whatever reason, we haven't met that goal, and we have to make adjustments on the fly from that perspective. And that's where David sits down with his leader and with myself and the team and say, okay, if we're going to come in short on a project, what adjustments do we need to make in our capital model to actually make that work? And we have those dialogues on an as-needed basis.
Yeah.
That's a great question. I see a hand back there.
Yes. Could you share, in addition to philanthropy, what else falls under the reporting line to your strategy officer?
Oh, wow.
Yeah,
That's a
that's a
good
lot.
question.
Planning, marketing, government, public affairs, innovation,
Consumer,
yeah, consumer,
communications.
Yeah, I hear a lot more than I want to hear at that meeting.
And over here, I'm so sorry.
No, please.
There you are.
The conversation's terrific, so no need to apologize. And I just want to say thank you all again for a great dialogue around this. We hear a lot about the importance of the CDO C-suite relationship, and I think we all naturally think of the CEO, but the fact is the CFO is one of our best and most productive partners. So thank you for modeling what it can look like. So I have a very simple, specific, yeah. Oh, but nobody else did. All right, my name is Grant Sterling. I'm with Lurie Children's Hospital in Chicago.
Hi, Grant.
Miss Manners, Sue over here, is my coach in all things etiquette related, so thank you very much. So my question is very simple. David, you mentioned how you might be looking at moving to quarterly distributions of donor dollars or transfers to the hospital. And I wonder, we certainly have this problem in small places, and others might as well, is that when those funds get transferred to the hospital, they're not always spent quickly by the physicians, researchers, healthcare providers, nurses, respiratory therapists, or whoever's responsible for them. So it puts us in a bit of a bind as donor-centric fundraisers, because when the donors' dollars aren't moving, we don't have a story to tell the donors.
Such a good
And, I'm thinking of one beloved physician who's saving it for a rainy day. And no matter how often we tell him, hey, Doc, it's raining right now. It's never quite raining hard enough. So I'm asking you, what experience or perspective do you have on this? And do you have any policies or tips to help us manage this issue? Thank you.
Anecdotally, working in higher ed, there was always the rainy day fund that the faculty member had. What I've found is that typically the researcher has spent more money than was in their budget, and what we're sending over has actually already been spent, and they just haven't called the dollars over. So we kind of have the opposite problem. Probably means we need to be raising more money than we are. So Todd, you can hold me to that. We need to be raising.
I'm good with that.
You talked about things we're wanting to improve. We don't feel like we've arrived, and we know that there's a lot more that we can be raising for. So unfortunately, we're not in that situation where we're having to force them to spend it. They're spending it. We just need to get it over there a little quicker. Do you agree with that?
Absolutely.
Okay.
There's a hand back there.
Yes, Todd, I'd be curious to hear your view as a CFO on endowments
That was
versus
something I
sort of
had
current use dollars. There's a debate, I'll say, brewing within my board at our foundation. there's a camp of folks who think, we got to build for the future, strategic investment, more endowments, getting a little bit of, I'll say, pushback from some of our leadership, our CFO saying, no, I'd rather have $100,000 to spend this year than to draw 4.5% over the coming years. What's your view there?
So, I would say we're kind of in that dialogue as well. We're a foundation that has some endowments, but I wouldn't suggest we have a large endowment process, and we're having that conversation about what is the right balance. So I would suggest for our organization, we probably don't have enough endowments as we move forward to that, and that's something that we need to focus on. It is one of the next cycle of improvements. David and I talk about it on occasion. We don't have a this is what good looks like for our company yet mapped out in that space. That's what we need to do. And it's probably traditionally because we've taken that approach largely as we have this capital project, this operational thing, this researcher that wants to work on this project that we have focused our energies on to this point. But cultivating that endowment process is an important part of what we need to look at. And I wish I had an answer to say this is what I think good looks like in that space. This is what we've already agreed we're going to put out as a template for the future. But that's work and one of the cycles of improvement we're working through.
Yeah, I think higher ed really probably, and that academic medical is probably more endowment driven historically. We don't have that tie to that academic institution yet, but I know that there are some needs in the Cancer Institute and desire to eventually be an NCI designated cancer institute that requires you to have a fairly large research endowment there. And so we're having those conversations now. Our first foray really into endowment has been to actually fund a couple of chairs for research. One for Alzheimer's, Parkinson's, and then another for more basic science research. And so we're putting our toe in that water, but we'll have to report back to you how that works out.
I'd like to respond with a quick story as we draw to the near end of our program. But a 92-year-old trustee that I've worked with for the last 5 years, who was responsible really for the foundation for this medical center going back many years. She said to me, and she was a big proponent of supporting plan gifts, an ambassador for plan giving. They're rare. But she was extremely adamant about cost of funds, how plan gifts work to the benefit. But when it comes to endowment, she was all about where do you think you're going to find the money to endow some of these programs? And she would say, I talk to Donna because that's where the money is. So if you're not including those conversations, whatever you're doing with your endowments, think about how to not just take money today for those important programs today, but also how to perpetuate and sustain those programs. That endowment is a conversation that could be part of the next level of your giving. So anyway, just something to think about. We have one.
I had a question about need versus capacity. For some of those projects where you do have the runway of the 24, 36 months, how do you determine what philanthropic component is part of that project? Is it a general percentage? Is it based on capacity of the portfolio? How do you determine that?
It's a case-by-case basis. So, for example, we just doing a new patient pavilion in Winter Park, which is a wealthier community, and we actually looked at a $90 million build there and did an analysis of our database to see what the feasibility was, how much we thought we could raise, and we actually determined it based on the donor pipeline in that situation. And we ended up raising about 20 to 25% of the total there. In other cases, the hospital doesn't have the funds, and we have to negotiate on a goal that maybe we don't see a pipeline or something that I feel that we can get done, and we have to stretch a little bit. But we go in with the full knowledge that we're stretching so that there are no surprises. I think you do the best you can in these situations, and I think what I like about working with Todd is that the transparency is there. We know what we're doing together, and I can be accountable for my piece, but he's going to understand when I've said, this is a little bit beyond. We want to try to do it, and I'll keep you posted on how we're progressing towards that goal.
There's one more, Alice. Yes, hi.
Hi, Jim Liddy from Graham Pelton. In a campaign environment, do you always, sometimes, or never argue about cash flow?
Is the correct answer always?
I never argue when cash flow's here.
Yeah, I mean, that's why we said that is always a discussion, and it should be. We don't always agree on what that number is, but it is a conversation. I think the worst case scenario would be not to have that conversation and then be surprised later on. So that is a conversation.
So I tell you the biggest dialogue we had a major gift a number of years ago. Probably was solidified in that 06, 07, 08 timeframe, and they were not able to deliver on their time schedule. And so where that conversation really becomes real is when it comes time for an audit. And I've got E&Y in auditing the books, and we're going to make a decision about how collectible that gift is that's now 1 year late, 2 years late, 3 years late. And so that's where the relationship you've got with the foundation and how and what we do and don't communicate out from that perspective, because sometimes from a GAP perspective, we will have to go make some different decisions than David is still pursuing. And David and his team are diligent about that. And I was very grateful that that gift actually did get fully funded and paid. That was really good for our organization. But there are times where you have those conversations about cash flows and about what is real and what is not real. And I go back, and I'm very grateful the time I spent at the foundation as a CFO, because one of the first things I had to learn as a young finance leader is the difference between a planned gift and a pledge and cash, and understanding that. So I would just encourage you, if you have one takeaway, if your finance team doesn't get that, go invest that time with them to help them understand that. And you need to invest your time in to help understand how they have to account for things, and that mutual understanding will benefit you greatly.
Thank you, Todd. Thank you, David. Thank you all for your attention and your patience at this hour of the day. I'm sure you're all feeling the need to stretch, but we want to thank you very much. I think that these gentlemen really did help bring out so many important threads to how we do speak at times different languages, but it's easy if we can work together from the inception throughout our relationships. So thank you all, and
Thank you.
have a great afternoon.